All right, good afternoon. It is 4 o'clock on Monday. Our update today is going to start with some good news and then move into concerns about where we are in COVID and what we might see moving forward. But let's start with the fact that today is a pretty historic day. As we speak, the president is speaking and then we'll be signing a bipartisan infrastructure bill, which is going to be transformational for this Commonwealth. It'll provide about $170 million extra every year for the next 5 years in road and bridge construction and repair. It's going to make the roadways that our kids travel on their way to school or church, that we travel on the way to work, safer, and that's really important. It's going to help us do major projects like the Brent Spence Bridge, and I hope it helps us speed up four-laning the Mountain Parkway all the way to Prestonsburg and getting that I-69 bridge built. It's going to help us build the infrastructure for electric vehicles, another $600+ million in clean drinking water and sewer work. It's going to help us have the infrastructure that we need to ensure that an economy that is on fire doesn't just continue for 3 years, but the next 30 years. So an exciting day going on right now in Washington. Also exciting about how it happened. Having people come together from both parties, supporting something that isn't red or blue, Democrat or Republican. Safer roads and cleaner water are just good for every Kentucky and every American family. And here in Kentucky, we continue to invest as well in important projects around the state. Today, we, along with U.S. Representative Hal Rogers, announced $9.18 million in funds for economic development projects in 10 eastern Kentucky counties. When completed, these projects will help support local communities and spur economic growth in the counties of Martin, Letcher, Floyd, Leslie, Knox, Knott, Owsley, Boyd, Pike, and Perry counties. The funding is through the Abandoned Mine Land Economic Revitalization Program. Congressman Rogers has championed this federal funding since 2016. We've seen over $140 million flow into Kentucky. This cycle received more than 70 applications for funding, and the projects selected include Cold Storage, LLC, receives $2.5 million for construction of an agriculture cold storage facility in Martin County, in which an underutilized existing spec building will be converted into a refrigerated commercial facility allowing apples to be stored up to a year after picking. Cowan Community Action Group was awarded $1 million to equip the Farmers Market Pavilion with cold storage, commercial equipment, and an office and stage, and to expand the Cowan Food Service Kitchen, as well as equip a food truck. Appalachian Regional Healthcare was awarded $750,000 to equip the Highlands ARH Medical Center in Prestonsburg with a diagnostic CT scanner and mammogram equipment. We're going to be able to provide better care to the people of that region. Leslie County Fiscal Court awarded $1 million to expand the Leslie County Recreational Facility by constructing a camping complex. City of Boonville was awarded $600,000 for constructions of cabins to allow overnight accommodations at Sag Hallow Golf Course. KCEOC, Community Action Partnership, awarded $750,000 to purchase an existing building on 10 acres in Knox County for a diesel mechanic shop and a CDL test site. Both critically important types of workers in high demand now that are going to help us put people in that county and the surrounding areas to work. They're going to lease the facility to Southern Kentucky Community and Technical College, which will operate it. The City of Ashland awarded $1 million to engineer and design a parking garage and convention center in downtown Ashland, something that community has needed. Pike County Fiscal Court, $700,000 to install 3,000 feet of electric lines at the Wolf Pit Industrial and Technology Park. We got to get the infrastructure up and ready to be build ready at places like Glendale, which we invested in over decades. Same here, making sure that we're getting that site ready. Knott County Water District, $600,000 for the purchase of 2 backup generators for the system that produces water for 3 counties, servicing 7,000 citizens. Finally, Hazard Community and Technical College, $280,000 for equipment purchases for the expansion of its successful lineman training program. Again, a high demand job that we are training folks for right now. These grants will help provide job growth and economic stimulus to these local communities. The grants are available for projects in 54 Appalachian counties in Kentucky with historic coal mining sites that have the potential to create long-term economic benefits. Since the program's inception in 2016, 63 projects in 23 counties have been selected for funding. Programs generated 143 jobs so far, including 83 positions at Dashcore Aluminum Extrusion Project in Perry County, and more than 258 workers trained in the East Kentucky Advanced Manufacturing Institute and at the Hazard Community and Technical College. So, again, if we want the future that is in front of us with an economy on fire, we have to invest in our workforce, we have to invest in our sites, and we have to invest in our communities. In the upcoming budget, you will see significant investments in our infrastructure, in our people, in our education, in our health. We are ready to rise to be an economic leader, and we have to take the steps that we need to so that we are ready to not only lead, but to continue to be a leader for decades to come. As we move into the COVID update, it starts with the tough milestone that we memorialized yesterday. So yesterday afternoon in the Capitol Rotunda, the First Lady, Lieutenant Governor Coleman, and I were joined by religious leaders and healthcare heroes as we held a memorial service to mark the heartbreaking milestone of losing more than 10,000 Kentuckians to COVID-19. During this somber and appropriate service, we heard the personal stories of loss and of struggle. I also announced the artist and design of a new permanent Team Kentucky COVID-19 memorial that will soon stand on the Capitol grounds as a tribute, as a testament, and as a memorial to everything that we have been through. It's just been a year and a half, and the pain, the sorrow, the grief that this has inflicted upon us is hard to place historically. We've lost over 5 million people worldwide, with over 10,000 of our fellow Kentuckians having succumbed to such an evil virus. As we said yesterday, that means the loss of Kentuckians just to the pandemic in a year and a half is closing in on the total number of Kentuckians lost in World War II, Korean War, and Vietnam combined. Now that 10,000 is more than the population of so many of our Kentucky cities. Imagine them, places that you love and that I love, completely wiped out. And the magnitude of this loss, it has a tendency, along with the period that we have been at war with this virus, to make us numb. And a big part of both hearing from the families that have lost, to the healthcare heroes, to the rest, is that we cannot grow numb. As we'll talk about in a minute, this virus likely isn't finished with us, as we're seeing rises in cases in Europe. And the family that we lose today is just as important as that very first family that we collectively mourn for, and we turned hundreds of thousands of green lights on. You know, when we look back on our fight against this virus, we're going to look at the whole time about what we were doing and how hard we were fighting, not at the beginning. And that's why we need everybody, collectively as a Commonwealth, to do the things now with more tools that we know can help protect us. Getting vaccinated protects you at a time when the virus is the most deadly. Getting vaccinated protects the family that are around you so that it's less likely that that virus is transmitted to them. Getting your booster keeps your level of immunity at a place where you are really well protected, but know that protection wanes over time and that booster is necessary. Getting your kids vaccinated is the way that we keep them in school. We get their life back to normal, or as normal as we can during these times, and it's how we protect those around us. It's how we protect those kids grandparents, the folks that come into their schools, the folks they interact with every single day, and yes, we'll talk about a little later, them themselves. It's part of our obligation to ensuring we never forget those lost and for those sacrificing right now. This COVID-19 memorial is going to be special. Amanda Matthews is a sculptor and a painter who was born in Louisville, now based in Lexington. Amanda is also the CEO of Prometheus Foundry, which focuses on public art, monuments, and conservation. Amanda's winning design for this Teen Kentucky Memorial project is titled United We Stand, Divided We Fall, after our state motto. It is going to be a special place where people can bring their kids to remember those we've lost, to remember the very best of us that we saw during this time, and maybe just to collectively thank those that have sacrificed so much during this pandemic. We haven't had a more deadly moment in our lifetimes. This is the third leading cause of death last year and this year. Only cancer and heart disease are more deadly. And the sponsors that I want to thank of helping to put this on. And I got choked up yesterday. They're the same groups that have been on the front lines the whole time, that have been sacrificing themselves and have lost some of their own. There are hospital systems that even when we didn't have the right PPE, still took care of us. So I want to thank Norton Healthcare, Baptist Health, St. Elizabeth, King's Daughter Medical Health Center, U of L Health, UK Health, and Pikeville Medical Center. You know, part of my faith is that pain, sorrow, and loss, they are a part of life, but that life itself is such a blessing and a gift that we've got to take those moments that we are blessed to be here and hold them tight and appreciate them. But also know during this pandemic that we can do things to lessen the loss and the grief, and to make sure that there are more of those positive moments with families. A lot of families are going to have an empty chair or two for COVID or other reasons this year for Thanksgiving and for Christmas. We'll have two of my extended family members that aren't with us for the very first time. Let's make sure that we do everything we can to lessen the amount of families that are going to spend 2 or 3 holiday seasons without their loved ones. And let's also dig deep, because this virus won't be done until it's done. And the answer to how long we got to battle it is however long it takes. It's out there with one mission to kill as many of us as possible. And so we cannot get tired, and we have to push back. And right now, what we're seeing in Europe is a new rise in cases and a significant rise in cases. What this should tell us is that until we have eradicated, or until we can fully control, until we have everybody vaccinated, this virus isn't done with humanity. It will still look for pockets and places to inflict its pain on. So let's have the humility to know the adversary we face is strong, and to be just as strong in what our response is and how we protect each other. So with that, let me go over the weekend numbers. But you know, the top line here is it does look like we have plateaued. In fact, this last week's numbers are higher than the 2 previous weeks, as is the positivity rate. So from Saturday, 1,561 new cases, 45 new deaths, including a 44-year-old man from Franklin County and a 44-year-old woman from Jefferson County. Sunday, 747 new cases, 11 new deaths. And today, 726 new cases, 10 new deaths, and they include a 43-year-old woman from Fayette County. Our positivity rate at the end of today, 5.73%. That's higher than what we'd like to see, but as I think you'll see in a minute, it looks like we've plateaued on the positivity rate at about 5.5%. And then what we're also seeing is there's now a responsiveness, maybe an elasticity in how our testing goes when there is more disease spreading. We have lots more tests that get done, and then it contracts as the spread is maybe receding. So as we move forward, we may pivot a little bit from the positivity rate and be able to talk about maybe some different indicators now that we're seeing how testing moves that may give us more information. So this last week, overall, 9,506 cases. That compares to the week before, 7,919. That is in fact larger than the week before that at 8,603. So let's look at our stair stepper chart. So as you can see, we had month over month over month of significant, we had week over week over week of significant decrease. And then we saw that slowing. And now we see an increase over the last couple of weeks. That's not a reason to think that there is another surge. This is always how the plateaus have looked. If we look back at the fall and winter surge, we went down and then we'd hop up for the first time after a couple of weeks, and then a little down and a little up. That is what we expect to see in the coming weeks. Now, remember, this is still higher than many times outside of any major surge in this pandemic. So it is still a very serious level that we are at. So some of the basic measures that we are taking to protect ourselves that reduce community spread, like universal masking in schools, we need to keep going. Positivity rate, again, as we look at this, remember, it wasn't this last week, but the week before that we saw the first tick up in that. Now, a slight additional tick up, but our positivity rate on a daily basis has been plateaued, going up a quarter of a percentage point or down a quarter of a percentage point on most days. The plateau also appears, and it may take a few more days, to show up in our hospitalization, ICU, and ventilator numbers. So if we look at hospitalization, right, this is, we've had some bumps before on our way down. This one looks a little more steady than what we have seen in the past. Indications are we are plateauing there. This is still far too many people in the hospital. These are our friends and our neighbors. It should be a reminder that the Delta variant, which is about all we're seeing across the country right now, is still very deadly and makes you sick at a much higher rate than the original strain of this pandemic. And think about this. It's that level right now, even with all the monoclonal antibodies and the other treatments. I mean, our treatments are much better than they used to be, but the virus is much stronger and much deadlier and makes you sicker than what we used to see. The ICU chart shows the same thing. Again, a plateau is you never hit a flat horizontal line. What you see is smaller increases and decreases like we saw in the ICU numbers in between the fall surge and the Delta variant. So that's really the Alpha and the Delta. But look, this plateau, if that's where we are, is higher than what it was in between Alpha and Delta. Now, I'll put in a plug here. I think those numbers can and will be lower if everybody gets boosted. Between the Alpha and the Delta variant surges, we were at the top of our game for those that got vaccinated in immunity. And we believe that means less people spread it, and you have fewer negative outcomes. Now, as we showed you, about a week ago, waning immunity is real. And we have every month more vaccinated individuals as a percentage, making up those that are hospitalized. That is a direct result of waning immunity that you can do something about. So get your booster shot. And then finally, the ventilator statistics, not as significant as the rest. That still appears generally to be going down, which is what we want to see. It's certainly our hope as we get additional treatments and options and more kids and the rest vaccinated, that this number will get down to the lower levels that it used to be. A couple of other points to make. Monoclonal antibodies. The supply nationwide is down, but the supply we have still exceeds the demand. So we are in an okay place with monoclonal antibodies. But if we were to have another surge like we did before, there wouldn't be close to enough nationwide. So again, it's a good reminder that right now we have enough to treat anybody who needs it. And that is a blessing. But we got to play a little offense. In other words, getting people vaccinated to make sure that remains the case. We also cannot, at the moment, put our faith in some of the other therapeutics that are out there. We're reading about them. We're excited about them, whether that's AZD, whether that's the new Pfizer pill version. They're all going to be incredibly scarce for a long period of time. The only way you're going to be able to get them is actually seeing a doctor. And while there is a hope that at some point there'd even be medication if you were exposed to somebody that you could take, that we get somewhere to that Tamiflu level, we are a long way off from that. So as we approach, and I'll talk about it in a minute, Thanksgiving and Christmas, remember how deadly that period was last year. K through 12, we've now performed over 220,000 tests in that program that we set up with schools, and over 1,300 schools are participating in some way. Final smaller point, we are working to close the books on cases, deaths in 2020, working with the CDC on that. I know that seems like it was a while ago, but that's the way that the CDC works, and that they continue to have you work the data. Two things are going to, is what we're seeing. Number one, we are seeing some death certificates where COVID was not listed as an original cause, that it's come back and for all the right reasons added. We're working on how to pick that up, because we just get the initial death certificate as it is filed. The second piece that we are working on is some death certificates just used a numerical code that would indicate COVID as opposed to the text, which makes the searches challenging. We don't think as an overall amount or percentage that there will be a significant number of additional deaths for 2020, but every death is significant. And we're going to make sure that as we close that, maybe this Thursday or next Thursday, that we're able to provide those exact numbers. And at that point, those numbers are permanent, even for purposes of history moving forward. So we've been through, when we look at the Delta variant and we look at where our hospitals were and overrun and how many people have died, we've been through hell. And thank God we've come out of it. We've come out on, most of us have come out on the other side. But we now know we're approaching the time that the Delta variant hit us so hard. And folks, we're entering a time where we really like to get together and be close inside. And that's Thanksgiving and Christmas, or if you're my family, Thanksgiving. My birthday falls in there. My mom's birthday falls after that. And Christmas. I really want everybody to be safe during this period of time. You know, with my family having, for non-COVID reasons, 2 empty chairs that have been at both of those tables almost my entire life, I don't want anybody else to suffer that additional loss. Thankfully, there are so many tools that can make it now safer to get together when, last year we were having to say, have it as small as you can. So, number one thing that can make your Thanksgiving or your Christmas safe is get everybody vaccinated, right? I mean, it's a tool where you can be together not be worried about it. That we're going to recommend a couple of other things and be safe. So if you have not been vaccinated, go out and get that shot as quickly as you can. I think you can be fully vaccinated by Christmas for that, and that's going to protect those people that you love. If you've been vaccinated, get your booster. Get it before Thanksgiving. That'll make it safer for you at Thanksgiving and beyond. I know we had all prayed that it would be available last year before that. It turned out to be in January, and there was a lot of loss from families that had gotten together. So, booster eligibility. If you received J&J at least 2 months ago, go get a booster. No matter what. If you're 65 or older, go get a booster. If you are 18 and older living in a long-term care setting, go get a booster. If you're 18 years or older and have underlying medical conditions, go get a booster. If you're 18 years or older and work in a public-facing setting, go get a booster. But I'll tell you what, there are a number of other states, just 4 or 5, I think, that just recently issued executive orders saying everybody could go get a booster. I'm going to look at it. We're going to analyze it because everybody should be able to get a booster 6 months after their second shot as quickly as we can. I believe that that's the way that we fight off the next wave, and I believe the federal government will come back around to it and to that decision at some point. You know, they take into account so many factors, the number of unvaccinated individuals that are still out there. Hard to get them vaccinated. They are slowly getting vaccinated, but we have enough right now to do both. So we need to, I believe, as a country, open it up to everybody. Start protecting children 5 through 11 by getting them their first dose of vaccine. And remember, get them the second dose 3 weeks later, because this is Pfizer. And remember, they're not fully vaccinated until 2 weeks after that. So I'd also recommend before the holidays, getting tested close to it. It's really easy. You can go in and then you know, right? You never want to go to a family gathering if you were positive. And then folks that when we gather in large numbers indoors, you know, we have to recommend masking. But certainly those members that are not vaccinated or fully vaccinated really should consider masking. So listen, these are holidays that I love. We're putting up the Christmas decorations right now. Some would argue it's too early, but you know what? After all we've been through, we're doing it right now. And it's really fun, right? It's really fun. I'm feeling this Christmas maybe in different and special ways. So let's make sure that there are only positive memories coming out of it. And if you share my faith, remember Christmas is about a lot more than just getting to do what we want to do. It's about celebrating the birth of the individual who taught us sacrifice and love and set the example about doing the right thing. So let's make sure we honor that in the way that we go about that holiday. All right, some good news after all that. I mean, we see what's going on in Europe. And we see the plateau. But over the weekend, 24,138 new vaccinations, new individuals being vaccinated in the Commonwealth of Kentucky. 425,401 Kentuckians have now been boosted. They've gotten their booster. That's 425,401. And in the first full week of 5 through 11-year-olds being eligible, 15,163 individuals vaccinated. We actually think this might double next week. If you look at, typically it takes about 3 days for us to get some of the numbers. And there are some school systems out there and some other groups that are doing an incredible job. So let's break down the demographics of our vaccinated population. We're still 58% of all Kentuckians, but of those now eligible, 5 years and older, ticked up 1% to 62, and the total 18 years and older. Remember, I always say these are people that get to make their own decision, now up to 71%. 75 and up, hanging at 89%. We really do. I mean, it seems like a great number, but it's the most vulnerable. We really do need to get that rest of that population vaccinated. 65 to 74 continues to be the demographic that is getting vaccinated at the fastest rate, 93%. 50 to 64 and 40 stayed the same. 40 to 49, up a point, 67%. This should go up because for the first time in the pandemic, this group is dying at a significant or a real rate. Prior, it was very rare. Now it's on just about every line list that I review at the end of each day. 25 to 39, up a percentage. And then the percentages stay the same all the way down to 5 through 11, which is right now at 4%. But for the very first week rolling it out, I think that this is a good sign. And I think we're going to see that increase. Now, there is a sentiment that's out there in the news. It's probably out there in society that there's a group of parents that want to wait and see, and I get that. I mean, I'm a parent and I love my children more than life itself, and my child has gone ahead and gotten vaccinated. I trust this vaccine that much. But the other thing that I'd encourage people to do if you're in that group is just also think about the holidays and the collective safety of that group and try to factor that in your decision and reach out and get information. I remember when my first was born, we didn't know my second was coming a year and 3 days later. But starting that conversation, even over all vaccines, and at that point, with us having almost no knowledge of the process and the science and the rest, and there were some books out at the time that were suggesting untrue correlations, vaccines and different outcomes. Just talk to the people that talk to your pediatricians. I mean, that's a lifeline when your kids are small. Talk to people that you trust. Hospitalizations. So we saw the concern about the plateau going through our hospital report. Hospitalizations have decreased 4% over the last 7 rolling days. That's the smallest decrease of a percentage. But we do have our least number of hospitals with critical staffing shortages in months, with only 36 of 96. And as we talked about monoclonals, again, less supply, but also less demand. All right, finally, we're going to talk about why that 5 to 11-year-old needs to get vaccinated. Let's put up first our line chart. 5 to 11 is the dark blue line. And remember, in the beginning of COVID, we didn't see a whole lot of cases because in the beginning of COVID, we looked at every case and the ages and we worried about everybody that got it. And so what it always was the lowest or the second to lowest demographic in cases. How many kids are actually getting COVID and could spread COVID or could get really sick from COVID? And you saw it stayed proportional all the way through the alpha surge, which is the first big one. But look at the delta surge. All of a sudden, it went to the second highest age group for who is getting COVID. This is a direct result of the lack of vaccine availability to them, because it didn't start that way. But you see where we started seeing the blunt in many ways of the vaccines themselves, and even as the Delta variant kicked up after that great period of vaccination, the other age groups didn't go as high because more people are vaccinated. So right now, compared to the rest of the population, if you have a 5 to 11-year-old, they are significantly more likely to get COVID than at any previous time during the pandemic. And it's happened, right? So the next set of numbers is since the beginning of the pandemic for this demographic, 5 to 11-year-olds, 1.9 million cases. That's 1.9 million kids, that age group, that have gotten COVID. 8,300 of them have been hospitalized. If you have a 5 to 11-year-old, picture them, 8,300 kids that age hospitalized. 2,316 with that very concerning reaction to COVID and what it does to your system. We've lost 94 kids in that age group. Vaccines protect against COVID-19. That is 94 too many. And I believe that if we would get this age group vaccinated, that number would be 0 or incredibly close to 0. And every responsible adult, I think, should want it to be 0. It's also safe. The numbers are just as good as they were for adults, 90.7% effective. And remember, that's with a smaller amount that kids get that's separately packaged and separately provided. Virtually every medical group here in Kentucky has looked at the science and encourages vaccinations. That's the KMA, the KHA, any medical organization, and their acronym is saying to get it. So it's available now. You're going to see some of our advertisements that will be out there again with all of these professional organizations because it's safe and we need to protect our children. With that, we'll open it up to questions. Looks like we have 7 total journalists, 2 here and 2 on the line. So we'll start with Tom Latek.
Thank you, Governor, and good afternoon to you. Where do we stand with the American Medical Association has today, one of their panels came out that they're going to combat misinformation that's being given out by medical professionals. What can they really do?
Question is, the American Medical Association has said they're going to combat misinformation by their by practitioners. What can they do? I think that's a question for them. Obviously, there are licensing agencies. There are rules and standards of conduct. There's, I before this was a practicing lawyer, and there is a group for that as well. But they can also be unified and speak in one voice the truth, but also very quickly denounce those that would spread what is false. And what we have seen is sometimes it takes 10 people telling the truth to combat one person that's telling a lie. And this misinformation is a set of lies. It kills people. There's probably different motivations for why people do it. In many ways, I think if you look at what's going on across the country or the world, it feels like the stages of grief, right? Anger, denial. But we can't let it continue because you'll have conversations and people have believed the lies that people have told them, and it hurts. It hurts those people. Mike Valente.
Should Kentuckians expect this virus to become this endemic? It's something that we have to learn to live with, and while we have effective vaccines and therapeutics, it's something we treat almost like flu season.
So the question is, should we expect that this virus becomes endemic like the flu or others? The answer is nobody knows. Some of these 1 in 100-year pandemics have turned into that, and some of them have ultimately gone away. I think we get to success either way through the same steps, right? It's ensuring that people get vaccinated. And if we need to get boosted from time to time and it tamps down the disease, let's do it. Certainly, as more vaccines get out to the rest of the world, our opportunity to get rid of it once and for all will be greater than ever before. I mean, when else in history did we have the opportunity over, and they always said it'd take a period of years to get it to the whole world, to get everybody in that period of time immunized. We also will have better treatment for it than at any time eventually throughout our history. So I still believe that we don't know and we will not know. Now, there's a lot of people who will provide commentary, but my goal is for us to beat it, for us to be able to get back to a full normal or even a better normal, whichever route we have to go. Karen Czar, WKY.
Good afternoon, Governor. Thank you. Thank you, Rachel. You touched on booster shots, and we asked you that a few weeks ago, and you said the same thing, that you'd like everyone to get them. How close are you to falling in line with the few states who are just going to go ahead and allow them now? And a second question, several months ago, or earlier this year, there was an issue with the death toll being off because of reporting with the health department. Do you foresee that as potentially being another problem, or has that issue been taken care of permanently? Thank you.
That issue has been taken care of permanently. Now we are seeing death certificates roll in from the last 3 or so months, which is a normal part of the process with hospitals and doctors being so overwhelmed. They were trying to keep people alive before they finished the certificates, which is fully understandable. I am analyzing very closely what those few other states have done on setting everybody up to get the booster. I want to know the legal effect because we have different companies that get different instructions in how to provide it. But I want to be clear. I believe that everybody over 18 that's been 6 months since they got their second shot can and should be able to get a booster. Debbie Yetter, Courier-Journal.
Hi, Governor. I wanted to ask about the booster shots too. If you decide to go that route, what would it take for you to affect a ruling like that everyone should go ahead and get the booster shot? And aren't Kentucky's regulations already pretty lenient in that regard?
So first, they are, I believe, lenient. I mean, I believe nationwide, 80% of people over 18 that have gotten a vaccine are eligible for a booster. And we're still looking over the law and what it would take to effectuate an opening for everybody. So that's something that we're looking at in real time, and hopefully I'll have some more information by Thursday on that. Stu Johnson, WEKU.
Thanks, Governor. Good afternoon. You talked earlier about the last couple of weeks now, how it seems activity has plateaued. I guess the question there is why? Is it, waning immunity? Is it the non-vaccinated breakthrough cases? Is it one more than another?
Well, I think it's the natural movement of the virus. Each time that we have had a surge, we have then had declining cases. I think we were able to cut the last fall and winter surge short because of vaccines. I think that saved a lot of lives. But then, it's based on now our level of vaccination and our behaviors. And vaccination includes boosters and levels of immunity, how many people have been vaccinated and what their level of immunity is or what it wanes to, along with are we out doing more and what's a community's stance on masking in businesses and masking in schools and masking in government buildings. So where the plateau occurs, I think depends on those things, plus the strength of the virus. I mean, we can't not include that the Delta variant spreads more aggressively. If it was the original version, who knows? We might already be close to herd immunity, but that's not the enemy we're dealing with now. Melissa Patrick, Kentucky Health News.
Hi, Governor. Is the uptick in weekly Kentucky cases a warning of what's to come, especially as colder states see increases in cases already and the holidays in front of us?
Well, I think the uptick in cases is, in the very least, a plateauing that should be maybe not a warning, but a pretty clear statement that this is not done with us yet. I don't think that it means that we are set for another increase, but the holiday season, in many ways, we shouldn't have to look at where we are in the last couple of weeks. We should look at where we were last year and all the families that lost somebody in December or January that could have been avoided. So in the very least, the fact that we are no longer in a decrease and what happened last holiday season should have people running out to get vaccinated before the holidays this season. You can protect yourself. You can protect your family. If you haven't wanted to do it for whatever reason, just knowing you're getting together with them, do it for them. And last, I think, is April Rickert, WFPL.
Thank you, Governor. It's April. Do you expect challenges with vaccination? Do you expect challenges with vaccination to 5 to 11-year-olds if their parents are more likely to be in the less vaccinated age group of 20 to 40-year-olds?
It's a really good question. I believe that vaccinated parents are probably more likely to vaccinate their kids, but we haven't seen it just happen. I guess no one's done the research, and that would be interesting for the somewhat older kids whose parents would fall into a somewhat older age group. But I don't want to say necessarily. I'd just say as a parent, with this virus going around and the way that it is, I might think that I'm invulnerable. Oh, but your kid is just so precious, right? And to me, even if I hadn't been vaccinated, it would be, what is everything I can do to protect this child, provided that I believe that it is safe? Now, I think your question also says that this is a chance, in some instances, to maybe have a new conversation with that person in that age group, that maybe 20 to 39 age group that hasn't been vaccinated, and to talk about both them and their child, because their child's safer if they're vaccinated too. So the psychology of all this is so complex, all of it, and it's even changed over time, and sometimes even become inverted in the way that people think about it. So we continue to try every strategy, provided that it is transparent and honest in communicating with people, but we are always open for any suggestion. Okay, so folks, I don't think we have to be alarmed, but we have to be knowledgeable, and we have to be clear on the fact that COVID is still here. But the great news is that we have so many different tools to beat it. Remember, we've lost 10,000 Kentuckians. We don't have to lose more. We have an economy on fire that I think everybody wants to be a part of. We are so close to realizing our collective dreams as Kentuckians, a state that others have sometime looked down on. We have a chance to change that, and for us to be the leader. We have waited so long for this moment. So let's make sure we protect one another and do what it takes to beat the pandemic, and then to run forward into a pretty incredible future. We'll be back on Thursday. Thank you all very much.